In 2010, your predecessor at the Department of Health and Human Services, Todd Park, who's now the U.S. Chief Technology Officer, kicked off this Datapalooza thing. It was the first one in federal government. How big was it then, and how has it grown since?
So it started off literally with 45 people in a room at the Institutes of Medicine. Actually, the Deputy Secretary of HHS, Bill Cord, described it to me the other day. He was reminiscing a little bit, and he described the scene to me as a tiny little side room in the Institute of Medicine, and 45 people gathered in there with a pile of 30 data sets on the table. That was the first Health Datapalooza. The second one was at NIH, a little while longer. There were about 600 people at that one. The third one was at the Convention Center here in Washington, D.C. There were about 1,400 people. Last year we had it just down the street. There were about 2,000 people, and then this year we've got over 2,000. We're waiting on the exact numbers, but it's been a packed house.
So, I mean, on the face of things, it seems like taking an idea from the 90s, Lollapalooza, this music festival, and slapping onto, a government convention or meeting or summit or whatever we want to call these times when you get people up on stage talking about things, which is something that's existed in DC for years. And yet this really seems to have taken off both in terms of the size of it, but also as a community that is self-sustaining. There's a consortium around it and a lot of energy that's self-evident and interest, excitement. What's made this different? What's the actual impact of this thing, which seems to have kind of a funny name, but to be continuing to grow?
So, I mean, first of all, I think it's the importance of the topic, right?
Mm-hmm.
And if you look at, I think regardless of where you are on the political spectrum or where you exist in the ecosystem of health and healthcare and human services, and keep in mind that's literally everybody in this country because everybody's a patient, right? We can all agree on one thing, which is that the healthcare system that we have in this country as we know it today is kind of fundamentally broken, right? One of my favorite statistics is that I always come back to is that we pay more per capita for healthcare than the next 10 countries combined, and our outcomes rank us only 32nd, right? Now, if we paid more for healthcare in this country and we had the best outcomes, well, okay, we could have a conversation about that. But the fact that we pay more and our outcomes rank us pretty far down the list, that's a problem. So, A, everybody can agree that we have a problem. Republican, Democrat, neither, doesn't matter. Secondly, I think that what's really become very clear is that a key element to solving this problem and the many facets that exist within this ecosystem is the use of data and the responsible and intelligent use of data. And as the use of that data has become more prevalent and we've seen more and more examples of how people can take information and do kind of amazing things with it to really solve problems and drive different decision-making processes that lead to better outcomes, we've just seen that explode, and we've seen more and more people get behind this idea of leveraging the information to do interesting things. Now, surely there are pitfalls, as we heard from many of the keynotes over the last couple of days. There are things to be wary of. Data is not going to solve all of our problems, right? But it's an important element in figuring out how we do things differently.
So people are a bit skeptical about the U.S. government's use of technology in healthcare right now for a number of reasons over the last year, some of which you're deeply acquainted with. What's the number one thing you think the American people should know about how data has been released and the impact it's had upon their healthcare over the past 5 years?
So we've really focused a lot within HHS of looking for all of these data sets that we've either created or curated or collected over decades in many cases, and trying to put them out there in sort of raw, machine-readable fashion so that other people can take the information and do God knows what with them. Very interesting things, right? I think from the very beginning, we were really pleasantly surprised by the fact that we had absolutely no idea what would come of this. And what has come of this are things that we never could have expected. People use these data sets in incredibly creative ways.
Such as?
So the folks, there's a really small startup in California called Stride Health, just one of the first ones that came to mind, mainly because I just had a conversation with one of them out there.
Sure.
But they've built a private health insurance marketplace, meaning private, meaning not built by a government, right? Mm-hmm. So anybody can log on stridehealth.com in California and shop for an insurance plan. But what they do is they actually calculate not just the premium that you're going to pay per month, but they try to estimate what a true cost for every plan is based on certain pieces of information you tell them about yourself and your family, current prescriptions you take, what kind of conditions you have, if you're expecting any procedures, etc. In order to do that, they actually use a bunch of different data sets that we've released.
Mm-hmm.
And we never thought that those data sets would be used in that way. That's just one example. Another example is a company actually that the secretary talked about today, that I talk about quite a bit. It's a company called Aiden out of New York. And what they've done is taken a bunch of our data sets and applied it to the post-acute care facility industry. Previously, most people, in fact, currently, because they're not huge yet, most people will pick a post-acute care facility based off a photocopied sheet of paper that they get handed at discharge from a hospital that lists 30 facilities and their name and address and phone number, and then they pick the one that's closest to their house. We have a whole bunch of data about the quality of these facilities along a number of different parameters, and what they've done is taken that data and built it into an application that allows people to actually go and search for different post-acute care facilities based on things that are actually important to them. And there are a couple things I really love about this, right? Number one, they're using data in ways that we never thought they would. Number two, they're actually actively disrupting the post-acute care industry. If they get big and their tool gets used quite a bit, all of a sudden the parameters that are important, that the post-acute care facilities are incentivized by, are going to be the ones that people are actually looking at. So hopefully things around quality, for example, as opposed to just geography.
So, U.S. government didn't pay to have these startups use the data. They chose to ingest it themselves.
Right.
What's the total cost to the taxpayer of releasing the data so that they can use it and kind of sustain its release over time?
It's minimal. I mean, there is, we've collected, as I said, we've collected and curated and created the data for decades in some cases, so we have processes in place that have been doing that anyway. In order to take those data sets and put them into formats that can be consumed by developers or by others, and maintain those resources, you require some people and you require some technologies, but the cost is minimal. I mean, I don't know what the exact number is, but we're talking hundreds of thousands of dollars, not tens of millions of dollars. And for the value that we get out of that investment, I mean, it's the value we get dwarfs the investment that we made.
Where should people go to learn more about the data releases and the startups or apps or services that have been created from it?
Healthdata.gov is a great place to start. That's where we kind of catalog all of our all of the data sets that we know of and that we can find through HHS. Mm-hmm. We've also started to catalog both state-based health-related data sets as well as some foreign data sets. We kind of want healthdata.gov to be the one-stop shop for where you go to find data. And
how much of it is there now?
We have about 1,600 data sets, I believe, right now.
Is there a total gigabyte or terabyte count of all that?
It's actually impossible to count that because a lot of these data sets change on a regular basis.
Estimate?
Oh, God, I have no idea.
Okay.
No idea.
Go dig in. It's a good
big.
project
There's
for somebody.
A lot of stuff there, right?
Okay.
And some data sets are probably more useful than others, but what's really interesting also is that one man's dirt might be another man's gold, right? You never know how these things are going to be used.
All right, digging in the open data dirt.